Let's turn now to more on the cyber attacks which have brought disruption to hospitals in and around London. Fears of a second wave of attacks didn't materialise today, but while many services have returned to normal tonight, some problems still persist. Kate Bradbrook is at the Lister Hospital in Stevenage, but first let's go to Karl Mercer at the Royal Free in Hampstead. And Karl, what's the situation there tonight?
I'm actually at the Royal London in Whitechapel, Riz, which of course is one of the biggest hospitals in the capital, and the trust that runs this is the biggest one in the country. It also runs Bart's Hospital, it runs Whipps Cross, Newham and Mile End hospitals, and it was one of the worst hit by Friday's problems. At the time, trauma services, stroke services were cancelled, ambulances were being diverted to other trusts around the capital. But I'm pleased to say things are improving. All the trauma cases are now coming here, as are stroke services, ambulances no longer being diverted, and the hospital tell me that they are now able to do things like CT and MRI scans. The kidney dialysis service is back up and running. That's the good news, but they say there are still problems. The IT system hasn't been fully rebooted. So there are problems with outpatients, there are problems with planned surgery, and clinical teams here have been going through the lists for tomorrow, saying, look, who can come in tomorrow, who can wait till another day. So the hospital apologising to patients. And a little earlier I caught up with the medical director for the NHS in London, Vin Diwakar. I said to him, this hospital seems to be over the worst. Is London?
Well, as the situation currently stands, it's improving. Of course, we can't look forward into the future and predict what's going to happen tomorrow, but the system certainly responded magnificently.
Yeah, and any ideas of when it might be back up and running at full capacity?
Well, the situation's been improving. In Bart's Health, they're undertaking a major upgrade of their systems, and as I say, 15 general practices, that's less than 1% of the total have been affected. So in London, we've been coping well.
Yeah, 15 out of 1,500 GP practices affected. But also, he told me there were some other trusts that did have problems with MRI and CT scanning equipment, the Chelsea and Westminster, London North West hospitals and Barking, Havering and Redbridge trusts. So that's the picture here in London. Now I'll hand you over to Kate Bradbrook, who's at the Lister Hospital in Stevenage.
Yes, a large hospital here, more than 700 beds. There were big problems here on Friday, also over the weekend. Engineers working around the clock to try to get things back online. It's an improving picture here today, but some services still not working, include diabetic eye screening and also non-emergency blood tests, and the message is not to attend A&E unless absolutely necessary. Now, I've been here all day talking to patients. Some didn't even know there was a cyber attack. Their appointments going ahead as normal. Others, though, have come here. Their appointments have been cancelled. They haven't been contacted, and they say they've had a wasted journey. But to put this into context, there are more than 5,000 computers across several sites. Each one needs to be checked individually. Also, this is one of the first hospitals to be affected, and bosses say that's why it's taking so long. Just a quick look at other hospitals in Hertfordshire. The trust, which operates in St Albans, also Hemel Hampstead and Watford, it says it's had big IT issues recently, but nothing to do with this cyber attack. It's asking patients to turn up as usual unless they've been contacted.
Kate, thanks very much. And to Karl, who was at the Royal London earlier.